important to have enough D. Working in your garden would give you that. I was told to do
What do you
that.
say is the amount of vitamin D we should be getting?
Well, that's an excellent question. I will tell you this. If you have osteopenia or osteoporosis, it's 2,000 IUs a day. But if your vitamin D is very low, you may well need more. The recommended level of vitamin D that you need is 30 or greater. Speaking only for myself, my level was 23, and I was already taking 1,500 IUs a day. So now I take 5,000 a day to get my level up greater than 30. And some alternative medicine people think it should be 50, but I had a woman in my clinic about 3 weeks ago who was a very bronze individual, and I just glanced at her as she sat down. It was our second visit or so, and I was reviewing a retake of her hormones, and her vitamin D was 80. And I said, wow, I said, you're going to have to back off the vitamin D. We don't know the implications of having it much greater than 50. And she laughed and said, well, I just got back from a cruise. Actually, I forgot to take it with me. And then I looked at her, and she was, just like, brown. And I realized, wow, in the sun, that's the best way to get it. But, so anyway, it's a good question about D. But again, that's what I do in my clinic, which is unique. It isn't one amount fits everyone. It depends. How much sun do you get? And how well do you absorb the vitamin D from the sun? Some people, redheaded, very fair people, don't, absorb it from the sun. So you want a level of 30, however much it takes to get that amount. And so there's actually this is a wonderful, I thought it was so good I wrote the name of it, enzymatic therapy, the old unattractive name, menopause formula. I mean, it's helped a lot of women that have terrible hot flashes that are, for whatever reason, not a candidate for hormone replacement. And, the synthetic permethrin breaks down into four metabolites in the body. And the synthetic progesterone, or it's not like progesterone. It doesn't act like progesterone in the body. Progesterone is a mild diuretic and aids sleep. Progestin has none of those qualities. But the testosterone that one would would get if one needed it as a woman would be a compounded formula. There is no pharmaceutical available. So bioidenticals, we just try to reproduce what was once found circulating in your body. And cumulin insulin instead of pork insulin is an example. It's an exact copy of the insulin that someone makes when they're making insulin. So these are the three types of estrogen, and it's the estradiol is the primary estrogen you make when you're 25, looking good, feeling good. And this just is a complicated discussion about the metabolites of estrogen, which has helped to be the friendly type of metabolite by taking the cruciferous vegetables and cruciferous vegetable extracts. We want more of the 2-hydroxy estrone and less of the 16-hydroxy estrone in our body, basically. And the indole-3-carbinol is the product that comes from broccoli, cabbage, and kale. And it's important that we take that to help us metabolize it in a healthier way. A lot of this there's still ongoing research. So some of these things like the estrogen metabolism and eating the cruciferous vegetables, it may well be not that particularly useful, frankly, but it is certainly not harmful. And again, our gardening expert would agree, we should all eat more vegetables, specifically in this case broccoli. And that's far better than taking it in a capsule, but taking it in a capsule is a poor second choice as well. I mean, it's good for you. So testosterone is very important for women, and it's necessary in life and in our bodies and so on. Improves mood, helps with endurance, strength, and libido, of course. And testosterone replacement is as important as estrogen for women as well, but it has to be given by a cream. And again, we do check levels, both after you're replaced with it and what you need beforehand. It's similar to vitamin D. I mean, people need different amounts. Your skin absorbs it differently. Really, it isn't well understood. I can just tell you that the amounts found are different. And then, of course, the hormone replacement can be done with like a little pellet. That's something inserted under your skin, usually in your upper hip, and it dissolves in your body over time. You know, it's a cream, a pill, a pellet, and so on. And there are side effects that everything we do, whether you drive in this highways in a car, you get hit by a drunk driver, no matter how carefully you drive. And whether we get your levels exactly correct, they're all exactly balanced, they're all exactly bioidentical, you could absolutely still have all these side effects. And you can have all these side effects as well if you don't take hormones. Some studies have shown, however, that there is perhaps an increased risk, perhaps 8 in 12,000 women, of having more side effects of cancer, blood clots, and so on, if you do take hormones, whether they're bioidentical or synthetic. The blood clot issue, I think, to some extent can be ameliorated by taking the omega-3 fish oil. It helps our platelets not to become so sticky under the influence of estrogen. And so progesterone is much milder with side effect risk and so on. So progestin, remember, is not progesterone, but they're vastly different. Progestin is a pharmaceutical, whereas progesterone it is patented as prometrium, but it's also compounded. So anyway, this goes on and on about some of the side effects. And this is talking about the estrogen plus progestin was found to be the problem with the cancers in women, the breast cancer. But again, I can tell you the research is ongoing. So I do get people, and sometimes who come to my office and say, well, the bioidentical hormones, I don't have to worry about side effects with that, right? And I tell them, no, of course you do. I mean, there are side effects with everything that we do and don't do. I believe the side effect risk is more and increased perhaps with the synthetic. But again, as I said, that is a controversial issue and it's still ongoing. You need to have your levels drawn, your risk, work that out with you and your doctor. So, and use of combined estrogen plus progestin increased the risk of invasive breast cancer. And that was with progestin. The mammographic density also increased. So the WHI, that was the Women's Health Initiative, evaluated only a single regimen of a conjugated estrogen that's like Premarin with medroxy progesterone, that's the progestin. It didn't look at estradiol and progesterone. So anyway, it's a complex subject, but that's just a little tiny introduction. So thank you for giving me this opportunity. Is there any questions?
Well, I just had all my levels checked because I've been going through a lot of these symptoms, except I do still have my cycle. But my doctor told me everything was normal and wonderful, but yet I have a lot of these symptoms. And I'm not at the age that she thinks I should be to start having these symptoms. I'm 37 years old.
Well, normal is not necessarily optimal. So, optimal is what you are, I think, around 25 to 35. So when someone says you're normal for age, I'm 61, but I don't really want my hormones to be what they are when I'm 61. I'd rather them to be, I'm about 25. So, I mean, you have to ask that they're normal. What is your normal range? I think that would be the key question to ask. So the progesterone, as I said, is the first hormone to leave the body. It's not like when you think, thinking about it, you think it'd be estrogen, but it's not. Progesterone is. And then these handouts just kind of follow the talk, just a little outline of it as well.
So is this something that's ongoing, that you have to continuously do it for the rest of your life because it doesn't regenerate itself, it doesn't kick back or anything? You can't get it to a point where you don't have to continuously take medicine?
Well, the way it works is you take the hormones for as long as you want to feel good, look good, and be at a high productivity. That's my opinion, but this is what I do for a living, and it's not necessarily the consensus of opinion, but there are risks and benefits to everything we do and don't do. I know the standard, the standard thought on hormone replacement is you take it for as brief a time as possible until you don't have any side effects. The